Welcome to the second episode in our special series on cancer and COVID-19. ACCC wants to give cancer care professionals quick tips and resources you can use right now. This week, how to talk to patients about coronavirus. Dr. Jeffrey Kendall is Director of Oncology Support Services at the University of Minnesota Medical Center. We asked him for advice on how to speak compassionately with patients in these difficult times.
Everybody that's working with patients and actually working with their colleagues, we're all facing this at various stages. So when we talk about advice, it's really hard to give specific advice for a specific scenario. There are a number of mnemonic devices available, and if you were to Google it, you'd get 100. But I think two that are very valuable to get us all grounded in how to communicate, not only with patients that might have this infection or their caregivers or even our colleagues. But the two mnemonic devices, the first one is called GUIDE, G-U-I-D-E, and it comes from the COVID Ready Communication Skills, a playbook of vital talk tips. A second one is called SPIKES, S-P-I-K-E-S.
Can you walk us through the commonalities of the two?
So in the GUIDE mnemonic, their first step is get ready. In the SPIKES mnemonic, their first step is setting. Both of those are preparing yourself. And what I think is really important for people to remember, when we're going to have this conversation with a patient, caregiver, or colleague, there's two areas that you want to be ready. First is nonverbal. Take a deep breath before each encounter. Kind of clean your own space. And then finally, and most importantly, make eye contact. Look the person in the eye. This is the most important nonverbal piece of communication. So in the preparing yourself, we have a nonverbal set. Take a deep breath, move into the person's face, make eye contact. And then the verbal piece is have your information ready. Both of these mnemonics are basically saying in this second step, let the patient talk. Give them a chance to express their understanding of what's going on, their understanding of their own symptoms, or tell you their symptoms. But it's also a time for them to express their concern. And then the third set is provide. And this is where we give them the information that they need. But under the provide section in the verbal, this is pretty important. You want to speak deliberately. You want to use short sentences. You want to check for understanding. After, you give about 3 bits of information or 3 short sentences, ask the patient, can you tell me what I've just, but in your own words, I want to make sure I'm being clear. Now, the fourth commonality is emotion. There's a nonverbal and a verbal component. Again, humans naturally divert their eyes when somebody's crying or somebody's angry. So maintain the eye contact, stay in their space, and depending on the situation, some people like to touch a hand or a shoulder. Again, if you're a few feet away from the patient, that's not possible, but if you're not, it is. And then in the verbal piece of managing a patient's emotions or a caregiver's emotions, the real key is just to be genuine. Be yourself. Don't try to be something you're not. And it's okay to acknowledge this is a hard time. And then the fifth commonality between the two mnemonics we've been talking about is end the communication by making sure the patient knows the next steps. What are they going to do? Are they being admitted? Are they going home to self-isolate? Make sure they know what they have to do. One is preparing yourself. Number 2 is understanding what the patient knows and what their concerns are by letting them talk. 3 is providing information. 4 is managing the emotions. And then 5 is just ending it. So those two mnemonics really have some similarities that really help us not only give difficult information to a patient in front of us, but also work with our colleagues, and we can even use them at home with our family.
In the coming weeks and months, patients and oncology professionals will continue to have these difficult conversations. For more resources chosen by Dr. Kendall, check out the show notes. Until next week, for the entire Cancer Buzz team, this is Summer Johnson. Stay well.